whispers of breath and vessel weave a delicate tapestry in the silent symphony of existence. This study addresses a gap in understanding the effects of inhaled nitric oxide, INO, on exercise capacity in patients with COPD, specifically without constant hypoxemia and pulmonary hypertension. The primary objective was to evaluate the impact of INO on exercise capacity and identify potential structural or functional predictors of response. 61 patients with mild to severe COPD, average FEV1 at 65% predicted, participated in this double-blind, placebo-controlled crossover trial. Participants were randomly assigned to receive INO or placebo during 2 distinct incremental exercise tests. The primary endpoint was exercise capacity, measured as peak rate of oxygen consumption over the course of the trial.
Quick take. This trial aimed to determine the effects of inhaled nitric oxide on exercise capacity in COPD patients, focusing on those without continuous hypoxemia.
The trial found that the unadjusted effect of INO on peak oxygen consumption was minimal. However, patients with a higher small vessel volume fraction, BV5-TVV, exhibited significant improvements. The adjusted mean increase in oxygen consumption rate was notably linked to small vessel perfusion, independent of other factors like airflow obstruction. Importantly, improvements in exercise capacity were associated with enhanced ventilatory efficiency and reduced dyspnea. The authors conclude that there may be a distinct pulmonary vascular endotype in COPD responsive to INO, potentially characterized by reduced vascular pruning.
Quick take. Results showed potential benefits of inhaled nitric oxide on exercise performance in COPD patients with greater small vessel perfusion.
Short quiz, clinical vignette. A 68-year-old male with mild COPD undergoes an exercise test to assess responses to inhaled nitric oxide. His small vessel volume fraction is notably high. What change might you expect to see with treatment? Option 1, significant improvement in peak oxygen consumption. Option 2, worsening of dyspnea. Option 3, no change in ventilatory efficiency. Option 4, decreased exercise capacity.
The answer is option 1. The study found significant improvements in peak oxygen consumption in COPD patients with higher BV5-TVV, indicating better response to INO with higher small vessel perfusion.